access to service. Number 6, additional training for medical contractors to manage effectively veterans cases. And number 7, VA takes too long to take the payment sometimes for private sector healthcare providers. Some clinics are still operating from mobile units and tents due to hurricane damage. The clinics do not provide all the services of the medical center. The medical center in San Juan has only 280 patients and 30 beds for mental health patients that are expected to meet all the needs of over 93,000 veterans. There's a shortage of specialists such as radiologists, psychiatrists, and hand surgeons. None of the clinics or medical centers has a VA trauma center or mental health residential facility. Even in contract services, there's not enough capacity sometimes. Access to service is an issue like in the rural areas in the United States. But like the 50 states, veterans in Puerto Rico do not have the representation to legislate and vote to improve those situations. The best practices that we saw during the hurricane, we have to mention the hospital was among the few hospitals that was operating, running during the hurricane and the blackout. His representative was present at the Center of Emergency Operations of the government of Puerto Rico to coordinate efforts. Really, they did a really good job coordinating with our office and other state agencies. Our office was in all the VAH daily briefings, and I was giving a daily report about the situation of the veterans and the service of the hospital and the clinics. VA facilitate equipment and ITC lines to enable to set up a temporary service area where staff assisted veterans with over 900 FEMA claims. We had 3 persons working at the hospital, helping the veterans with their FEMA claims. Some recommendations. In the medical and mental health service operation, that facilitate the state and municipal agencies and non-profit organizations can submit proposals for grants for healthcare-related services. That we can maximize, our resources in the island. Number 2, implement an integral, holistic approach to healthcare, different from other parts in the United States where you have different type of programs, and here in Puerto Rico is limited what we have. Number 3, expose Veterans Health Administration orientation for private healthcare providers. Sometimes the office complaining how the way some of the private providers have been dealing and working with them. Allocate a small space in the clinic to set up service area for my office and other agencies, like the one we set up we have in Ponce and are proposed for Mayagüez and Arecibo. Support the Puerto Rico Department of Health plan to expand the state trauma center to designate an area that serves veterans and military only, and that serve a backup trauma center to the one that can be created at the San Juan Medical Center. Begin a feasibility study to build a trauma center at the San Juan Medical Center. It's something that veterans have been asking for many years. Things that we recommend during disaster preparedness or disaster relief efforts: set up a reliable communication backup system with satellite phones between VHA, state agencies, key medical and mental health service providers, and first responders. VHA facilitates equipment and ITC lines to enable my agency and all other VSOs to set up temporary service area. Provide medical and mental health service to all category veterans not eligible under normal operations. And I would like to mention in this part, and here in Puerto Rico, some veterans of the category 8, they cannot receive service in the hospital. When we had the problem in the hurricane that the private sector was not, these veterans were having problems because they could not be served during the hurricane. The idea is that during emergency they can be given service. On behalf of the veterans residing in Puerto Rico, we appreciate the opportunity to share our office insights and your efforts to improve the health service provided to our veterans. We look forward to collaborate on that goal. Thank you.
Well, thank you. Dr. Rodriguez, you are now recognized for 5 minutes, and if we could try to keep it to 5 minutes so
yes,
we
I
can
will.
have time for.
Yeah, sure. Good morning, Mr. Chairman Brad Wenstrup, Congresswoman Jennifer Gonzalez, and special thanks to Chairman Phil Roth and Ms. Christine O'Hill. On behalf of the governor of Puerto Rico, Ricardo Rosselló, thanks you for your presence and dedication in supporting Puerto Rico and our U.S. veterans. This is a historical Veteran Committee Congressional Field Hearings, the first that I witnessed, and I am honored to participate. Congresswoman Gonzalez, the veteran community of Puerto Rico is most grateful for bringing the House of Veteran Affairs Committee here to our state capital, and we salute you for this accomplishment. On behalf of all of U.S. veterans residing in Puerto Rico, I want to give you a warm Puerto Rican welcome. Today, I come before you not only as Secretary of Health of the government of Puerto Rico, I come as a former Chancellor of the University of Puerto Rico Medical Center, but as an active reserve component soldier physician for almost 30 years of military service and a veteran. I am proud of being an American soldier. I am privileged to provide testimony for the record for this oversight field hearing. President Trump administration and the U.S. Congress have begun the process of funding the most immediate emergency needs in Puerto Rico. I am sure that during the short visit to the island, 6 Hurricane Irma and Maria, you have obtained in deep appreciation and need awareness that much more remains to be accomplished to stabilize Puerto Rico, especially in the mountain region, and to set the island on a path for full recovery and reconstruction. The scale and scope of catastrophe in Puerto Rico in the aftermath of Hurricane Maria knows not historic precedent. The island-wide devastation presents an extraordinary to the U.S. citizens of Puerto Rico, to the local government and the federal government. The hurricanes brought high-speed sustained winds, heavy rain, and devastating flooding that like of which the island have never seen before. Roads and bridges failed, and roads blocked by debris across the island, leaving communities stranded and unable to obtain life-saving aid, food, water, and medicine for a period of weeks. More than 4,000 housing units were destroyed or experienced major damages, forcing hundreds of thousands of Puerto Rican U.S. citizens to seek refuge in shelters, home of their families and friends, and in the worst case scenario, to migrate to the mainland. One of the most distressful situations in providing health services to the population at large was the non-system communications, further compound of 2 neighbor islands, Vieques and Culebra. Due to the condition, many of our citizens decide to relocate in the continental USA on their own. During my recent visit to Orlando and tour to Orlando VA and Lake Nona, we informed that more than 900 of our veterans have enrolled in the VA health system programs in the state of Florida, of which 300 enrolled in the facility at Lake Nona. So, and just imagine the other state that could be veterans, Pennsylvania, Texas, New York, New Jersey, you name it. Our health situation was concerning even before the storm. Diabetes and HIV present major concern to our citizens. Also, we experienced over the last few years outbreak of Zika, dengue, and chikungunya. Thank God, we ended the Zika epidemic outbreak on last June, and about 2 or 3 months, they removed the travel advisory for Puerto Rico infection. The need of behavioral health services are highlighted after the passing of Hurricane Irma and Maria. Also, I believe that more analysis needs to be made concerning the mental health status in the island. The data before and after the storm is concerning. The mental health and suicide hotline received more than 26,000 calls between October and December of 2017. Of those, 9 expressed suicidal behavior. 6,000 were able to verbalize a plan to end their lives, and more than 2,000 had the intention. That is very concerning. Every single one of those calls is a saved life. However, not everyone with suicidal ideation called the hotline. In 2017, there is an increase of suicide by 29% in comparison with previous year. There were 196 suicides registered in 2016, and on 2017 ended with 253 suicides, 57 suicides more. As February of this year, we report only 24 suicides, a reduction from last year at the same time. The Department of Family, equivalent to the Social Services Department in the continental U.S., provide mental services to elderly and their providers of care. This is another area where the VA and the Puerto Rico Health Department should collaborate as U.S. citizens residing in Puerto Rico requiring help. This collaboration can take with the support of the University of Puerto Rico Medical Science Campus. Our healthcare system can assist the VA with their assets and keeping the veteran closer. Every single town and municipality in Puerto Rico have a primary care centers. These take care from the state government health centers of treatment and diagnosis or federal funded 330 health clinics. Veterans can access these clinics and centers faster and would reduce the appointment waiting time issues that the VA currently has. Another area, we are over? One, okay, another area government is interested is to explore the potential of transfer land to the U.S. Department of Veteran Affairs. We are proposing that the Fisher House Foundation build such facility on the VA campus in San Juan, which is adjacent to the Puerto Rico Medical Science Campus. At the end of the day, I am responsible of the well-being of the U.S. citizens residing in Puerto Rico. Veterans are heroes that are earned, but more important, they are U.S. citizens that I need to assist in the maintain the healthy of as all U.S. citizens in this beautiful island and part of our great nation. There should be more areas of collaboration than the one we have. After all, we have the same goals to deliver the best possible health care service with the limited resources to the U.S. citizen residing in Puerto Rico. Thank you so much for this opportunity.
Very much. Dr. Ramos, you are now recognized for 5 minutes.
Thank you, Chairman Westbrook, Chairman Rowe, Resident Commissioner Gonzalez, and members of the committee. My name is Victor Ramos, and I am the president of the Puerto Rico Physician and Surgeon College, an organization comprised of all licensed physicians in Puerto Rico. On behalf of the more than 1,000 physicians in Puerto Rico that I represent, I thank you for this opportunity to participate in this conversation here with you today on maximizing the VA resources in Puerto Rico to impact the health of our veteran population. Also are here with me Dr. Jorge Vidal of the Puerto Rico Radiology Society and Dr. Rafael Zaragoza of the Allergy Physician representing the private sector. Chronic understaffing has been a national problem affairs for many years now, and Puerto Rico, unfortunately, is not the exception. Ways in which to mitigate the shortage of providers within the VA health system has been a constant topic of discussion at the administrative and legislative levels, and meaningful initiatives have been implemented with no definite solution found. However, our demographic and geographic particularities have amplified the VA health system national understaffing. According to the Department of Veteran Affairs, there are over 93,000 veterans registered as residents of Puerto Rico, 65% which are over 65 years old, a number slightly higher than the national average. Although small in size, our jurisdiction is mostly rural, with VA health system treatment concentrated in the San Juan metropolitan area. Access to this facility is difficult to relate health condition of the veteran population, as well as the lack of an integrated public transportation system. And in contrast to the stateside population, our veterans use the VA health system rather than other health insurance they might possess as their primary health care provider. This perfect storm of an aging population with required health intervention and over-utilization as compared to is further compiled by the exodus of physicians in large part of specialty from Puerto Rico. The staff position in the VA health system in Puerto Rico remain open and funded, but requirement hindered by the lengthy and archaic bureaucratic hurdles that physicians are made to jump through in order to be considered. Employee staff is further subject to high taxes in Puerto Rico, which are compounded by the economic pressures upon physicians, higher cost of living in Puerto Rico. Lateral move within the VA health system from Puerto Rico to other jurisdictions automatically result in a de facto rise with money in physician pocket at the end of the day. Although the government of Puerto Rico has incentivized physicians to stay in Puerto Rico by granting them special tax rate for staying in or returning to the island, more needs to be done to stop the outmigration and bring them back to the island. It must find ways to make it more attractive for physicians to apply for staff positions and to remain in those positions in jurisdictions like Puerto Rico with particular high understaffing issues. The Veteran Choice Program is one of the ways VA is improving access to care for veterans, but allowing them to receive care from non-VA facilities, connecting them to timely and convenient access to health care instead of waiting or traveling long distance to a VA facility. This program applies in full force in Puerto Rico. However, it faces the same understaffing problem encountered in VA facilities because of the burdensome bureaucratic requirements to physicians to participate. The VA health system could provide better care to their patients by opening its program to additional providers merely by simplifying their contracting procedure. I am aware of the budget concern of programs such as the Veteran Choice Program. As help-resolve schedule congestion and understaffing. Easier and responsible access to physicians outside the VA health system will also help break the circular problem of lack of availability specialty to treat the veteran population in Puerto Rico. Physicians, and to a large extent specialty, are leaving Puerto Rico for stateside jurisdiction because of the high cost they bear in providing their service in Puerto Rico. Puerto Rico has losing an average of one doctor less. Last year, prior to Hurricane Maria, 700 physicians had left Puerto Rico. I estimate that a larger number will leave this year. Of the 400 cardiologists in Puerto Rico 11 years ago, today we have less than 100. The number of anesthesiologists has decreased in the same proportion. Very few neurologists and surgeons remain. And in the island, this is one of the principal health problems. This is an urgent need for endocrinologists. It's not a rare occurrence to call a doctor for an appointment only to be told that appointments are 3 to 6 months away. Nor is it to call all the doctors in a certain specialty in the phone book only to be told that they are no longer accepting new patients. Yes, this is partly due to a local factor, such as the cost of living and utility costs. However, it's also due to Medicare reimbursement rate between our Iceland doctor in Puerto Rico and their stateside counterpart for the same service under the same terms and conditions. For example, after 20 years, the GPC applicable in Puerto Rico was finally equate to the of the U.S. billing and Iceland, although that numbers not take into account the cost associated with the Jones Act, which not applied to the U.S. Virgin Islands. It is also